And Prioreschi, an orthopedic surgeon at Connecticut Orthopedic Institute with Hartford Healthcare, talking about arthritis in young adults. How common is this, doctor?
Well, thankfully, arthritis is less common in the 30s and 40s than we see in the 60s and 70s, but I still see several patients today who are suffering with arthritis related to an old sports injury or a work injury.
All right, tell us about some of the telltale signs when someone should seek out a doctor like yourself.
Certainly. So patients will want to watch for symptoms that aren't getting better on their own or are in fact getting worse, and those symptoms that have failed to respond to things that most people would think to try, like rest or ice and over-the-counter anti-inflammatory medications. For knee arthritis, it's typically pain around the joint, and for hip arthritis, we typically see complaints of pain in the groin or radiating around the outside of the hip.
All right, what are some of the treatment options available for younger athletes with hip or knee arthritis?
So I start with a conservative management protocol. These include modifying the activities that they're already doing, targeted physical therapy at specific problems that the athletes will have, prescription anti-inflammatory medications and injections. If they fail those less invasive treatments and they're still having pain, which impacts their quality of life and their ability to perform the athletic activities that they enjoy, then we discuss surgery. For the young patient population, knee arthritis surgery can include robotic total knee arthroplasty with implants that the patient's own body will grow into for improved longevity, robotic partial knee replacements, and then on the hip side, robotic or manual total hip arthroplasty with implants that are specifically designed for longevity. For truly high-level athletes and laborers, hip resurfacing is going to be an option that can return to competitive level athletics.
Wow, a lot of options. All right, doctor, talk about how robotic technology has advanced these replacement surgeries in young people with arthritis.
Certainly. So robotic surgery has allowed me to decrease the outliers in my practice to provide more consistent and exceptional outcomes. It allows me to create a 3D model of the patient's anatomy based on their bones and their ligaments, and allows me to use that model to better position the implants for function and longevity. In addition, for hip surgery, I can model the patient's pelvis in space as they move from a seated to a standing position to better align the implants for increased range of motion and longevity for hopefully the rest of their life.
All right, Dr. Brandon Prioreschi, orthopedic surgeon with the Connecticut Orthopedic Institute. Thanks for joining us today.
Thank you very much for having me, Lisa.
Thank you.